Hello wonderful people. In this video we're talking about psychosis and depression. Two things that are usually separated, but when depression gets extremely severe, it can develop into a depression with psychotic features. And we're also going to talk about what we can do to treat psychotic depression. But before we get started, I just wanted to introduce myself. Hello, my name's Dr. Sil. I'm a junior doctor from Sydney in Australia, and I'm particularly interested in mental health medicine. If that's something that interests you, you can consider subscribing to the channel. Okay, let's get into the video. So I think the best way to start to understand depression with psychotic features or psychotic depression is to understand psychosis and depression, both of which I have videos about on my channel. I'll put the links into the description. Now, depression, as per the DSM-5, which is the Diagnostic Statistical Manual that mental health professionals use to diagnose mental illness, has quite a strict criteria, and it involves the following. Essentially, it's 2 weeks of a set of symptoms, but two of those symptoms have to be either a depressed mood called dysphoria, which is, everyone knows what a depressed mood feels like, but it has to be persistent for 2 weeks. Or the second fundamental symptom is anhedonia. So anhedonia is the loss of interest, the loss of pleasure, the loss of any kind of emotion for 2 weeks. So if someone stops doing something they used to love, I don't know, say it's ping pong for example, and now they're not playing ping pong anymore, that could be a symptom that is anhedonia because they're just not enjoying the things they used to enjoy. There's also other symptoms that are involved in depression, things like issues with concentration, the feeling of persistent guilt, problems with sleep. There's a lot of other symptoms, and you can look at my other videos if you want to understand the criteria in more depth. So that's the depressive illness, okay? Now, the psychosis we've talked a bit about in the schizophrenia video I've made. So psychosis is a set of symptoms, okay? It's not a diagnosis in and of itself. It is a set of symptoms that are involved in multiple diagnoses. So you can have psychosis with depression, but you can also have psychosis with bipolar, and of course there are many psychotic illnesses like drug-induced psychosis or schizophrenia. The symptoms of psychosis can be grouped in different groupings, so the positive symptoms, and this is really related to having high levels of dopamine in certain pathways of your brain, the corticostriatal pathway, and that results in things like delusions. So these are fixed and false beliefs that are just absolutely not true. So thinking that the CIA are following you, street signs are sending you personal messages, or that the TV is sending you personal messages, thinking you're being followed all the time. These are all different delusions. It also can be hallucinations. So these are false sensations. So you think you are hearing things, you think you are seeing things, but those things aren't actually there in reality. And most commonly it's the auditory hallucinations, hearing voices. And especially with psychotic depression, these voices are usually extremely negative, just awful, and they say really mean things. They put you down, and they might promote you to do self-harming behaviors. So if you have depression with auditory hallucinations, with someone telling you to harm yourself, that's really dangerous, and you kind of need to be in hospital to stabilize the symptoms. The final symptoms of psychosis are the thought symptoms, the cognitive symptoms, and this is when people become really thought disordered, where essentially the logical train of thoughts that you and I are having and that you can hear from what I'm saying, every sentence I'm saying is following from the previous sentence, at least a little bit logically, I hope. But if you are in psychosis, then it can be extremely difficult to follow what people are saying, and they will be tangential, and sometimes the words won't even follow, and it'll be like a word salad. Oh, and I forgot to mention the negative symptoms of psychosis. And so these are the things like lack of motivation, okay, social withdrawal, the lack of facial expressions, okay, blunted affect, and also the lack of spontaneous thought, okay, we call that poverty of thought, poverty of speech as well, where you don't speak much. So I hope you now have a good understanding of what depression is, which is this persistent low mood or lack of feelings mixed with other symptoms, and what psychosis is, which could be delusions or hallucinations. So you can imagine that when these two things mix, you can have the low mood associated with a delusion that your body is rotting, or that hallucinations of people telling you life isn't worth living, and you can hear voices telling you to do things like harm yourself, okay? So it can be awful, and unfortunately this really does need help. This isn't something that you can just kind of talk through with your mates at the pub or with your friends. This is something that you need to talk to a mental health professional about. But that's also a wonderful thing, because we're nice people, okay? We're not so bad. We want to help you. So the most important thing that you have to do, or if you or someone you know has these kind of symptoms, is to get to the door. Okay, just get to the door of the GP or of your primary health provider and just start the conversation. Okay, they'll take it from there. You don't even have to think about what to talk about. They'll handle that. Just get to the door. I also just want to take a second to make the point that this isn't an easy diagnosis, because to know whether you have depression with psychotic features or a psychotic illness like schizophrenia that's causing mood symptoms is a little bit of a fine distinction that kind of mental health professionals have to make. So it's not something you can just do by watching a YouTube video. But it's important to know that whatever the case is, there's hope, okay? There are therapies available. Although talking therapies are really important for this kind of thing, it's also really important to take medicines to help, because you do have an imbalance in neurotransmitters. So too much dopamine in certain parts of the brain, too little serotonin in others. And we know that the medications that decrease the dopamine and increase the serotonin do have positive effects on the function of people who take them. And mixing them with other therapies, so talking therapies with psychologists, just general physical good health like exercise and good diet, and also sometimes if it's quite severe you might use electroconvulsive therapy, which is a safe and very effective therapy for these kinds of things and way better than what media portrays it to be as. It's not as scary as you think. So all these therapies do have quite positive outcomes for people who have this awful condition that can be debilitating. And using these therapies, you can have such a fantastic and wonderful life. So there's plenty of hope, guys. And if you know someone who has this, share this video with them. There's a lot that can be done. All you have to do is get to the door, okay? That's the one thing I want you to take away from this video. All right, guys, that's everything I wanted to talk about in this video. I hope you're all having a wonderful day. If you want to support the channel, please consider leaving the video a like. That helps my channel grow. We're a small community, but it's a lot of fun being on YouTube, and I'd love it if you joined the pack. So just hit the subscribe button if you want to see new videos on mental health and well-being. Other than that, have an absolutely wonderful day, and I'll see you all in the next video. Bye for now.